are.
Hi guys, I'm here in Dr. Jessica Wu's office. Dr. Wu is a celebrity dermatologist. You've probably seen her on a bunch of shows and magazines like Vogue. I actually met Dr. Wu a few months ago at an Aveeno event, and it was funny because I had just finished reading her new book, Feed Your Face, so I was very excited. I'm here in Dr. Wu's office because I'm actually about to get Botox, which if you've seen my videos, you know that I'm actually a huge Botox fan, but a lot of people aren't, and I feel that there are a lot of misconceptions when it comes to Botox. So I wanted to ask Dr. Wu a few questions, and I actually tweeted, and a few of you sent me your questions to ask her as well. So here we go. We'll just ask her some of the questions. Hi, Dr. Wu.
Hi, Nadine. Happy to be here.
Thank you. Yeah, thank you for answering these questions. I know that a lot of people are sort of confused when it comes to Botox. And the biggest fear that I hear is that people are going to end up with a frozen look. Can you talk about that and how that's not necessarily something to worry about?
Sure. Well, the biggest misconception is that Botox paralyzes you. It does not paralyze you. It relaxes the muscle, and unlike substances that could paralyze you, it's not permanent. The relaxation, the softening of the scrunching, the softening of the wrinkles, the relaxation of the face wears off in about 3 to 4 months.
Okay.
So it does wear off, it's not paralysis. And really how you look depends on the technique that's being done. It depends on the expertise of the doctor who's doing it. For example, we don't blame the scissors when someone gets a bad haircut. Right? we talk about the skill of the person cutting your hair. Likewise, make sure if you are considering Botox to see a doctor who has a lot of experience doing cosmetic treatment so you don't look crazy.
Okay. And, you know, so when people have that really, really sort of frozen tight look, I mean, that's something that you actually have to actively either request or have a bad technician.
Yes.
That's not normal when you get
Yes, that's
Botox.
right. In fact, I always try to tell my patients that it looks more natural and prettier and younger to have some movement, to have some smiley eyes, and to have some natural ability to raise your eyebrows. I've been getting Botox myself since I was 28, so
Same as me.
almost 15 years now, and you can see I can raise my eyebrows. Right?
There you go.
I can move my face. I don't look crazy. I don't have crazy eyebrows. And that's because I only get tiny amounts, little baby amounts of Botox a few times a year. And that's really all you need, a little bit a few times a year to keep you looking natural and soft.
Okay, and then in the rare cases when, you know, for example, there have been a couple of celebrities recently who I won't mention that have had bad Botox, and then on Modern Family, for example, a couple of weeks ago, there was a funny episode where Jay gets Botox and then his eye kind of falls. You know, is that common, or that's something that's pretty rare?
Well, it's really unusual to have side effects like a droopy eyelid, which has been written about. More common side effects include a little bit of swelling, a little bit of pinkness, a little bit of discomfort at the site. It is very unusual to have a droopy eyelid, but the good news is, number one, it goes away, and number two, if you go to a doctor, there are ways to fix it with eye drops, for example.
Oh, good. Okay, I didn't know that. And then a couple of the questions I had online were, you know, is it true that Botox can be used to treat things like migraines and underarm perspiration?
Absolutely. Botox has been FDA approved to treat both migraine headaches as well as excessive underarm perspiration, and that's a real problem because it's not just a vanity issue. Some people are debilitated and can't go to school, can't go to work because of severe headaches, and Botox can be life-changing for them. Likewise, some of my patients have to carry 3 sets of shirts, 3 blouses in their bags to work every day because they literally sweat through their blouses, or sometimes people sweat on their palms and it's hard for them to handle paper, or to type on a computer, or to shake someone's hand. So it can really be life-changing for these medical reasons.
Okay, okay. And if you're thinking about getting Botox but you're sort of scared, you know, who would you say are good candidates?
I would say if you have a frown line that is really intense when you frown, but then relaxes when you, or goes away when you relax your face, I would say that would be the perfect candidate. And you have to be ready. I tell my patients, doesn't matter if you're 20 or 40 or 60, if you're not 100% sure that you want to get it, maybe it's time to wait and go around to different doctors, interview different doctors, find someone that you're comfortable with, and ask people like your esthetician, your facialist, the woman who waxes you. These people who are in the beauty business, they hear about who's good, who the good doctors are with good technique and good results.
Awesome. Thank you so much, Dr. Wu. I appreciate it.
You're welcome. My pleasure. Bye.
Bye.